Hi everyone, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So I'm sure you know the common cold is the major cause of visits to doctors and to missing school and work in most places. There are over 200 viruses actually which cause the common cold. Most people don't realize that, and the symptoms include obviously runny nose, congestion, sneezing, sore throat, sinus pain, sometimes headache, sometimes fever, and red itchy eyes. But the symptoms vary from person to person and cold to cold. So since the common cold is usually caused by a respiratory virus, antibiotics are useless, despite your doctor usually giving you antibiotics, and antibiotics are for bacterial infections. So we shouldn't be using antibiotics to treat the common cold. So vitamin C has been proposed for treating respiratory infections since it was isolated in the 1930s, and it became particularly popular in the 1970s when Nobel laureate Linus Pauling concluded from earlier placebo-controlled trials that vitamin C would prevent and alleviate the common cold. So since then, there have been over 24 new trials undertaken. Vitamin C has been sold and used as preventative and a therapeutic agent for the common cold. So let's fast forward to today. So the most robust and clinically cited evidence comes from a large Cochrane review on vitamin C for preventing and treating the common cold, which included placebo-controlled studies with doses of at least 200 milligrams per day. What did they find? Well, regular ingestion of vitamin C had no effect. Again, no effect on the common cold incidence in the ordinary population. And this was based on 29 trial comparisons involving just over 11,000 participants. However, regular supplementation had a modest but consistent effect in reducing the duration of the common cold symptoms. And that was based on 31 study comparisons with about 9,700 common cold episodes. In 5 trials with 598 participants exposed to short periods of extreme stress, and that included marathon runners and skiers, vitamin C halved the common cold risk. So what's the result? And what's the conclusion? In the general population, vitamin C supplementation regularly does not lead to clinically relevant reduction in the incidence of cold or cold symptoms. Analysis show no consistent effect on the frequency of cold. So based on that data, the authors of this large Cochrane review conclude that routine supplementation for cold prevention in the general population is not justified nor effective. All right, with that, hope you learned something today. Thank you so much for listening. For more information, you go to my website at www.paladinmds, and hope you have a great day.